Hello, good evening, everyone. Pleasure to be here. Thank you for giving us the opportunity. The gentleman here earlier actually took a bit of a punchline, which I was going to ask all of you, which was what percentage of our daily consumption of body's energy is actually consumed by the brain. He's already answered it, but the fact is that today, when you have 20 to 25% of consumption being done by a single organ, I want to kind of extend that fact to asking all of you, how many of you got like your recent annual health checkup done anytime in the last 6 months? Okay, quite a few, at least about 30% of the room. Did any of you get a cognitive function done? Cognitive function test done? Well done, ma'am. Really well done. Did you even know that such a test was available and that such a test is available with almost every general practitioner in the UK and the advanced countries? Some of you knew because you're closer to the field, etc., right? But the fact is, because India is a demographically young country, we have not had so much of exposure to the fact that your brain function can also be measured, that a cognitive function can be used as an early screening assessment of potential neurodegenerative risk. Our company essentially is all about making this as mainstream as possible. And just like how in the advanced countries one can walk into a clinic and get a cognitive assessment done, our company is all about making that mainstream in India. We recently did about a sample set of about 5,000 odd cognitive tests, varying degrees of accuracy. One was a very small 7-minute cognitive assessment test, and the second was a detailed 30 to 35-minute FDA registered test, which was benchmarked against gold standard tests like CAN-TAB. So we'll share the data of how India is generally doing. And very specifically, please don't take it as a complete declarative statement of how India is doing, but very specifically urban, educated India, because largely this was an English-speaking population. So that's the context to what are we here to present today. My name is Isaac, and my co-founder and I founded this company because of having seen personal instances of neurodegeneration in our own families. So we've seen what not getting neurodegenerative tests done in time does to a particular family. Fortunate to actually also have Minnow Susan Joseph, who's our neurocounselor. She's ex-NIMHANS, incidentally, also worked with an institute called CBR just down the road, and she's the one who works with a lot of our clients on a day-to-day basis, helps them track their cognitive test by helping administer this test. Alongside, we have a clinical and neuroscience team, which is about 40 years of combined experience, which includes the chairman of geriatric medicine at Manipal Hospital, Dr. Anup Amarnath, PhDs from specializing in neurodegeneration, and a neuropsychologist called Jwala Narayanan. Now, Jwala Narayanan incidentally published a paper a couple of years ago stating exactly the fact which I began this talk with, that delayed onset of dementia is a real problem in India, and cognitive testing, if advanced, could help us save a lot of research. So if you search Jwala Narayanan, ResearchGate paper, you'll have access to that paper. It was done by also alongside with Dr. Ratnawali, who's one of the most foremost experts of dementia in India. I'll not spend much time in terms of why cognitive health is important. I think we've all come to a longevity conference. We know why cognitive health is important. But I do want to spend some time on the difference between how globally cognitive tests are conducted, administered, why they are so widely accessible, and why India is lagging in that segment. And then, of course, we'll add some color to the data that we have collected along the way, and share some of the key findings, which I'm actually very happy to see that some of the data that we have from an extremely small set correlates to some very, very large researchers that were talked about both on the main stage as well as this stage. But before we do that, I know you guys have listened to a lot of talks, so help me out here. Tell me, how many dogs do you see? No answer is right or wrong. So 6, 7. And when you got to 6 and 7, you first went from 3 to 4 to 5 to 6 to 7, right? You didn't instantly arrive at 7. You pushed a little bit of your gray cells in that regard, right? And this is an example of what a cognitive assessment typically includes. You use certain visuospatial skills, you use certain reasoning skills, you try to figure out what is really in there. And this is the kind of test that we're talking about. So we're not talking about an invasive test, we're not talking about MRI, we're talking about something that can be done from the comfort of your home. And this is the kind of test that we're talking about. If the right answer matters to you, the answer is 7. If any of you thought 8, do go ahead and look at the image once again. So yeah, why is cognitive health in vogue today? And I think the surest form as to why this is important has actually come in form of some of the biggest longevity doctors in this field. I'll quote only one, who is Dr. Peter Attia, who essentially talked about neurodegenerative risk as one of the four killers of humanity. The other three already know about. Neurodegenerative risk is anything to do with dementia, Alzheimer's, and the like. And it is very, very interesting to see that today, out of all the presentations that we saw a lot of talk about cognitive function measurement. We saw something about homocysteine being measured. I think there was another gentleman who also said that can we improve, was that like was this program able to elevate homocysteine levels or not? So the thing is that it can be measured, it can be screened early, and this is something that is extremely important if a particular organ is consuming 20 to 25% of your daily brain, daily energy consumption. Now, when we looked at the data around, how India is structured, and I think some of you have already answered it. Today, unfortunately, if you go to your GP in Indiranagar, Banashankari, or wherever you are from, it's highly unlikely that your GP today will have a cognitive function test available. If you go to there and say that, I want to get a cognitive function test for my parent done, unlikely. They will send you to a neurologist. The neurologist is extremely busy with, obviously higher order cases of trauma, epilepsy, accidents, etc. So, they will send you to a neuropsychologist or a psychologist. So imagine the friction that you have to go through, right? So the point is that when it comes to global trends, cognitive testing is very easily integrated into the healthcare system there. Obviously, the fact that this is a part of a very largely insured, audience also helps. It's already a part of their places. AI-driven scans and genetic screenings, of course, enhance assessments, and this is not even like a routine part of healthcare. One of the most, I would say, sort of startling discoveries around this is the exercise that we will show you today began in UK in 2006. And sometimes we wonder if we're really definitely not that behind UK, right? So why should cognitive testing be that behind? Today, UK has got a biobank data of about 500,000 people. You can build neuroimaging technologies on top of it. You can add genotyping data on top of it, and actually provide a pretty accurate representation of what the average UK genetic person actually, what his cognitive function is. In India, this is just a very, very early start. And of course, all of this is with the idea that we can focus on early detection and help reduce neurodegenerative risk. Now, the cognitive assessment, like I mentioned, two of them. One is actually like we have an interpretation layer on top, wherein we look at their scores and we group them under people, which says that excellent, well done, and needs attention. And this is a part of our work that we take very seriously. It's important for us to not come across as an alarmist company. So the idea is that the bar should be so low so that more and more people pass this test. So if you're not passing this test, there's definitely something that probably needs further investigation. And that's where our clinical team jumps in. The other bit, which is a mini assessment, it's a simple cognitive age test. It's a concentration-based test. We test your divided attention. We test a couple of your frequency, tapping responses, etc., and give you a cognitive age. It does not have any clinical screening or output, but it at least gets you used to the fact, like similar to the kind of test that I showed you earlier. So this is what really emerged from our first set of 102 fully done cognitive assessments. 88% of the participants actually showed above average or average. The 10% who showed they need its attention essentially went through a clinical kind of pathway, which was extremely personalized to them. We went deeper into their health and lifestyle data. This exercise happened between October, November, December, so this is just 1 quarter data. But now we know that there are 10% people who, if you ask me, more than the 102 that we have done, we are prouder of the fact that we were able to detect 10 people who are potentially at risk, and we were able to catch them early. This is something that is extremely significant in workplace settings. We had a particular question in the questionnaire, and at that point of time we had no idea as to how the data would turn out, as to if you're clinically diagnosed with depression, anxiety, or PTSD, or you have mild cognitive impairment, please tell us, and tell us when you first diagnosed. People who said this at an aggregated level, people, and there were about 20% of people who had this condition, 25%, 23%, sorry, they actually perform lower on our cognitive tests. And I think we all know this, right? When we are not feeling good, when we don't want to look forward to the next day, when we don't want to look forward to the next conversation with the boss, when we're not feeling well mentally, it is affecting our process at work. Sometimes I think all of us probably struggle that, expressing that to our bosses, but this is an extremely important part of what we were able to uncover. I have a few copies which I'll circulate around because we obviously do not have time to go through all of this. But this is how the stacking order of skills really stacked up. And yeah, this is the other bit. This was urban India data. 90% of the data were actually from the top 8 cities, and this is what was concerning to us. Now, Rahul and I were actually small town boys from Kerala. We built our career in Delhi, Bombay, Bangalore, Dubai, etc. And our parents were left alone. And this is a reality of the urban India we live in. Almost all well-off families will send their children abroad. Our parents will be left alone. Loneliness, if you remember Dr. Thomas's talk, was one of the risk factors, one of the 14 risk factors, that affects neurodegenerative risk. All the more reason why, if urban India is moving towards that, we kind of make this as mainstream as possible. And obviously, there was also some interesting bits that came about, exercise and diet. To sum it up, our work here is literally just starting, but we have realized that the accessibility of technology and the intellectual depth that institutes like CBR and IIC bring actually unlocks immense potential for us to take this forward in a very, very meaningful way. And today we've talked about only one, games-based, but, and some of you spoke about it, like I think the other one, that can it be touch-based, can it be vision-based, can it be voice-based? These are all ways for eventually, 250 million households in India, anybody who's got a person above the age of 45, 50 to actually be able to access this on their mobile and be able to do this for themselves and see, every 2 years or 18 months or whatever it takes, just like exactly how all of us did our annual health checkups. And yeah, that's essentially our time. Thank you.
One or two questions?
Thank you. Excellent talk. I am Dr. Alex.
Yes, okay.
I represent Via Vikas and Dementia India Alliance. I think we can use it at scale.
Yeah.
I don't know, what is the cost of this?
Well, if we have to use it at scale, we'll make it work. The cognitive age test is free. So the idea is that we use that as a first step of screening device so that more and more people can use it. And we can use that as a layer to, do the longer test, Dr. Alex. So, but it's to give you an answer, it's about 1,800 rupees. When we get bulk orders, we really crash the price down.
So we'll touch base offline and try and...
Absolutely.
Thank you, Herb Giebel here. Just very quickly, I wasn't able to see the legend on your earlier slide where you showed right here.
Yeah.
Could you just tell us what they are quickly?
Yeah, I will. So cognitive stimulation, the questionnaire was what percentage of you, actually engage in some intellectually stimulating activities like music, reading, solving puzzles, and all of that. And that's what the data looked like. In fact, the worrying data in the social stimulation part actually said that, no, one of the options was that, no, I don't do any social interaction in a week's time. It's only 1 to 2 times or, less than. So this is like no social interaction in a week at all. And this is like 1 to 2 times a week, which is like significantly, like worrying, especially when it comes to urban India. And the data on towards the right-hand side is, like 3 to 4 times a week and every day. So those were the legends. Are we exercising enough? Rarely or never is the first set. Occasionally 1 to 2 times a week, then 2 to 3 times a week, and then 3 times a week or more.
So these are only frequencies of that particular item of low
Yes.
exercise. It's not related to dementia.
No. This is not related. No, not at all.
One quick question, Isaac.
Yeah.
I have the mic, so let me
Okay.
go ahead.
One question just
Yes.
for me.
Yes.
So how did you set the cutoffs, on some of the criterion?
So this is, it's a great question. So this is actually based on a acclaimed cognitive risk questionnaire called the CogD questionnaire. And just like Dr. Thomas had mentioned that, they adapted salmon oil for, like other Indian relevant items, we actually adapted that questionnaire for, let's say, more grains-based diet consumption. So very much sort of took something that was global standard and then adapted it to like slight modifications for Indian palates and Indian, like references.
One quick question, Alex. This way. Yeah.
Yeah.
Thanks. Post-COVID, a lot of health issues came out with Indian population, especially the young population. However, the term mental health, don't you think it has a stigma and prevents a lot of people from asking for help?
Absolutely. And I think that's why the reason for us to make it as mainstream as possible. Today, unfortunately, if all of you have any diagnostic apps, PharmEasy, Tata 1mg, the Lot, Metropolis, you will have tests for liver function, heart function, kidney function. You don't have anything for brain. So I think the way we want to kind of popularize this is to make this a common set for everyone. It doesn't matter whether you use Ivory's test or you use MOCA or you use Addenbrick's cognitive examination. The idea is that it should become as mainstream as possible, sir.
Is this test publicly available, at least the mini test? If it
Yes, yes, it is available. It's available on our website as well as on our app.
Okay.
Okay, what?
Yeah, so like I mentioned, the 10% needs attention. We actually have a very personalized pathway then. We pick the thread up. In some cases, they have been sent down the road of radiology, deeper pathology, which means that, blood tests, MRIs, etc. So our clinical team essentially picks each of them and either puts them in touch with a neurologist or the required medical expert in their city. Or if they are in Bangalore or Bombay, where we have like ready access, we only take care of them. So, and the idea is also like, especially if they are, let's say, on the lower medium of high risk, right? We want to actually administer another cognitive test in about 6 months' time after suggesting the multimodal interventions, that finger study, etc., that is very widely established. That if you work on all of these things, exercising, social stimulation, like the right diet, you should be able to either maintain your cognitive performance or improve your cognitive performance even. So that's the way in which we are currently dealing with that.
Sir,
Yeah.
did you observe any significant difference between men and women when you conducted these tests? Because when we go to social stimulation and social gatherings, in the late stages of life, we find that women have a better social interaction as compared to men. So, do you?
Not really, but I'll tell you one interesting fact. Women are early adopters of our tests. So when we look at a set of, like, let's say, any 10 people who come to us on any given day, 60 to 65% are women. And then we ask them as to why are they doing it. What we've understood is that men actually don't want to talk about their issues as openly as women. Women openly admit to us and our team saying that I'm going through menopause, a lot of things is happening. I just want to ensure that this is also like not broken, right? So I think that's something we have understood, but we don't know the social correlation. But it's very obvious that men take a lot of time to open up to. In fact, women sign up their husbands rather than the other way around. So that's some anecdotal data.
Okay, we're running short of time. Let's
Thank
thank
you.
speaker
Thank you,
once
Azhar.
again.